How is depression diagnosed? Over to you.
Dep-
You can run us through the diagnostic criteria.
So the DSM, with its multiple versions, and in the latest version, is also talking about 8 categories of symptoms, out of which the five should be present to for a period of 2 weeks minimum for depression to be diagnosed. These symptoms can be majority of the day with a depressed mood. It could be loss of pleasure. It could be changes in the weight and appetite. It could be slowing down of mental and physical thought, which is usually not noted by the patient itself, but the environment or the people in the environment. Um, or feeling overly fatigued, feeling worthless, and as we discussed, the loss of concentration and attention abilities in everyday life. So once, if you meet five of the criteria for over a period of 2 weeks, we are able to diagnose clinical depression or a major depressive episode.
Excellent. Very, very good. You virtually run through the entire list. The only two points which I would like to add here, you mentioned feelings of worthlessness. There are two other things which are important for me to mention because they lead to the worst possible consequence of depression, which is
Suicide
suicidal thoughts,
ideation,
and
right?
suicidal attempts. So there
Yes,
is, in addition to all the other symptoms that you've listed, so the person starts to look at the future and he feels that, the future is never going to be any
hopelessness,
better than my present is. That is a feeling of hopelessness.
hopelessness.
There is a tendency to compare yourself with people around you, coming out inferior in the process, which is worthlessness. And then you start realizing that whatever you do, you're not able to come out of this situation. That's a feeling of helplessness. This triad is a collection of three things: the triad of hopelessness, worthlessness, and helplessness. it
Leads to
starts
suicide
it
ideation.
starts to escalate, and then the person starts to feel that what is this life that I'm leading? This kind of life is not worth living. And at
Absolutely.
the age of 30, 40, 50, even, yeah, we see suicide at sub 10-year olds now, in adolescents, definitely. So in these age groups, when this thought comes into your head that, life is not worth living, but you're not going to get a natural death,
Hmm.
that is when you start thinking of ways of ending what you feel is this pain, this misery, which has no
Cure.
logical end, no rational end in the foreseeable future. And that is when people start to contemplate self harm.
Yes,
And
self
this,
harm
I
and
think, is
suicide ideation.
yeah. So this is the complete spectrum of depression, and this is how you would diagnose depression. This is how I would diagnose depression.
Absolutely, absolutely.